months ago, we were at the White House at this workshop.
That time, when we
yes.
did that thing. Where was it again?
So, and it was
sorry,
called,
I always have to do that. I'm sorry.
Participants, partnering with participants with research. And we had a lot of cool ideas coming out from that day. It was a really great day of listening and, to other stakeholders and trying to figure out stuff. And some of these ideas we've been working on, and there's a group of us, some providers, some patients, designers, and we got some feedback from some really, really cool stakeholders from some large organizations. And we're going to announce some of these ideas now. And it's basically building on what the problem of the lack of diversity of voices in healthcare conferences. I don't know if some of you were here on Friday morning, but we gave you some evidence, some data on this issue. And just to quickly recap, the number of patient voices at healthcare conferences have actually not meaningfully improved the last 3 years. And it's a little bit shocking because we have conferences like this one and several others who does an awesome job on lifting up voices that are not heard well enough in this industry. So what we're going to do about it is that we're going to throw some more data at the problem, obviously, and then we're going to try to put some fire on it, fire up some people, especially fire up some conference organizers. And so what we're doing is that there's this website called the Healthcare Hashtag Project, and we're getting close to 7,000 healthcare conferences that have registered their hashtag with it. So it's a place where organizers come and register their hashtag. And so what we're going to do is, in that registration process, we're going to ask a few questions like, do you have patients as attendees? And other questions like, do you even have patients as speakers? And all the way up to, do you have patients as part of the co-designer of the event? So we're going to start collecting that data. And what we're going to do about it is we're going to have a page, where we're going to do some real-time analytics, so you can see which conferences actually are doing this kind of stuff. So we're going to give credit to those who are doing it, and I hope someone here can fire up those who do not, because there's probably going to be some conferences missing on this list, and I hope somebody can push some buttons, and that includes even not just us here, but also sponsors of conferences. And so that's step one, collecting that data, providing that list. And we're going to do some real-time analytics. We're going to present all the data we've been researching the last few years. We researched several thousand healthcare conferences. We're going to publish that so you have some data points to cite, to reference. And and we'll start there. And this is obviously an everyone included registration process. So we're gonna promote this new way of designing conferences, and for the organizers who are not familiar with it, we're gonna educate them. So those who have no idea, those who say, oh, we don't even invite patients, we're gonna educate them politely, and follow up with them seriously. So it's something that I think needs addressing. Like many here have been trying a lot of things. Let's just throw even more data on it and push harder.
Thank you. I also want to add, from our perspective at Medicine X, I definitely don't want to give anyone the impression that we think that Medicine X, as it currently is the ideal of where conferences should be, or that we are even. I don't want people to think that we're saying that this is the exemplar. I think it is a movement that is constantly evolving, and our interest is simply to to give an incentive for other conference organizers to invest the time, energy, and resources to try to broaden their community within their conference the way that they can with the resources that they have, understanding that not everyone has all the resources to do everything. The other thing that I asked Simpler that when we were talking together about was the opportunity for people who attend an Everyone Included conference to give feedback to an impartial third party. So don't give, I actually said, hold me accountable. If I promise to do something, then hold me accountable. Can there be a way that you can help me understand, number one, how I can do it better, and number two, tell me if I got something wrong, if I didn't do what I said I was going to do. So in your packets, you may have seen Everyone Included verifier sheet. And essentially, that sheet lists how we did everything we said we were going to do. And it asks you, as people who attended Medicine X, to go to the Simpler website, not the Medicine X website, but the Simpler website. And it's an opportunity for you to let them know if, based on everything you know, we were able to live up to our promises. And if we fell short, then let Simpler know. And that way, we're taken out of the equation. It's just about us, understanding how we can improve, but also having someone who's impartial to that process. And so we can have openness and transparency about the feedback process. And so that website, there is a website on that sheet of paper that you can go to. And I encourage you to do that. We've prepared that information on the sheet for you so that you can look at it and see if you agree with it. And if there's any discrepancies or you see things that can be improved, let Simpler know. Because that way, that'll help us get better and help you feel more comfortable in giving us your advice and your opinions. Is that about right?
That's right, yeah. So we're going to try to do some verification when they say they have a patient or an attendee or a speaker. We're going to have some third parties try to verify that, and with the survey. And on that note, like if you can complete the survey to Julie Fligar and Dennis Boyle, that would be awesome. It's a really, really great survey. She can tweet it now. That would be helpful.
Okay, all right. Okay, thank you so much.
Thanks.